I want to welcome you all today. Thanks for coming out to our monthly noon brain breakdown. Today's topic is stroke. My name is Dr. Clarke. I'm a rehab medicine physician practicing in the Clear Lake area for the past 3 decades. I'm currently the corporate director of brain injury treatment and research for Pam Health. I have an MD degree, but I also have a PhD degree in neurochemistry and cell biology. I began working with Mr. Tony Mizutano, who's a founder and CEO of Pam Health, about 35 years ago. I've helped him start 2 or 3 rehabilitation hospitals in the Houston area. Pam Health now has rehabilitation hospitals all over the country, so he's expanded his network significantly over the past few years. He also has long-term acute care facilities, and he also has mental health facilities. It's just a marvelous organization. I wanted to say that Mr. Mizutano is a unique guy. He personally stays involved with all his hospitals. He visits each one of them regularly. He interacts personally with the staff. That's really unusual for a corporate in corporate medical health, and that's it's to his credit. In addition, and here's the important point, he also stays actively interested in implementing new state-of-the-art programs in his hospitals, both in and outpatient. Today we're going to talk about stroke, his neuro rehabilitation program, which will be expanding in other PAM facilities. This is a program that focuses on the new neuroscience of brain protection and regeneration. Mr. Mizutano now has an academic appointment in collaboration with the University of Houston in Clear Lake in their Institute for Health and Human Performance. I had to read that because I can never remember it. Pam now has its own dedicated lab in their facility where we are integrating the latest neuroscience with rehabilitation. I'm not aware of any other hospital corporation that's doing anything close to that. Clear Lake, University of Houston in Clear Lake also has interactions with NASA with different projects. It's very exciting to see that develop as well. So today we're going to present some of this new science on stroke. So let's get started. So this is our collaboration with the University of Houston Clear Lake, the Health and Human Performance Institute. I probably should have just read this off the slide. The theme of this talk is that when we put the neurochemistry back in the brain the way it's supposed to be, and we implement physical and occupational and speech and language therapies, we get recovery of function. And it's just like the little girl who's learning how to play the piano. She sits down, she struggles through the first song, and her parents have got fingers in their ears and they're just muscling through it. After a couple of weeks, she's playing it beautifully. That music and all of those finger movements, all that motor function is integrated into her brain, and she will never forget it. At 65, she'll still be playing it for her grandkids. And that's got to be amazing to you. It is to me. So what we need to do is we need to do that in recovery from strokes. We need to implement the chemistry like the young girl has. She's still young, all of her chemistry is beautiful in her head. Now we practice, and that's where physical, occupational, and speech therapy come into play. So there's not any other programs I've ever worked with or any other hospital corporation I've ever seen that is doing this kind of state-of-the-art medicine and rehabilitation. Exciting. So I have these obligatory demographics I've got to do. So up to 80% of the strokes are preventable. Any sign of a stroke, call 911 immediately. If you have one while we're standing here, let us know. It can happen to anyone at any time. Stroke recovery is a lifelong process, which indeed it is. Stroke is the 5th leading cause of death in the United States. Family history of stroke increases your probability of having one. And there's an entity called transient ischemic attacks, or a TIA, where you feel like something's happening. Your arm gets weak, or you're having trouble walking across the living room. And so you go to the ER, they CAT scan you, there's nothing there, no sign of a stroke, and while you're in the ER, the symptoms go away. So the doctor tells you, well, you have a TIA, so here, take some aspirin, go home, call your neurologist, get in to see him as quickly as possible. So that, unfortunately, is an ominous sign of things that might be coming. So that's all the more reason to don't ignore it. Go see your neurologist and get a full evaluation. So here's the old stroke facts from the American Stroke Foundation from a long time ago. So you know that occupational influences like a stressful job like all of us have, and if we're over 50, which some of us are, and if we're African American, we have a much higher risk, and if we're having sex, that's a terrible risk factor. So no more sex. No, actually that's a misread. So this is an old slide, so what they meant was gender. So men do have a higher risk than women, and women typically have a stroke at an older age, and they are more likely to die from it. So that's a really sobering statistic. So you're free to have sex. Not right now. So here's another thing that is actually outdated. This says that hormone therapies increases your risk of stroke. Now that is true for birth control pills. So it turns out that the new data, actually it's been around for a long time, from 1996 to 2020, there's studies all over the place, that show that estrogen, progesterone, testosterone replacement prevent brain cell death. They increase your antioxidants, we're going to get into that. They decrease your cytokine inflammation, we'll get into that. And they neutralize these toxic neurotransmitters, and we'll talk about that. But those are the key things that are cause or result from a stroke. So actually estrogen, progesterone, and testosterone decrease the effects of a stroke. So this is the typical Be Fast acronym, and this is the stuff you want to watch for if your loved one's walking through the kitchen and they complain of, or they're stumbling around, they complain of blurred vision. You see the face is a little bit weak on one side, and they're stumbling around with speech. They may add an extra syllable to a word like strawberries, and then they begin to speak gibberish. You know something's cooking. Get them to the ER. Be fast, but be faster than fast. So if you have blurred vision when you see this slide, you may be in trouble. So we probably need to make a room for these people upstairs, so we get them in their rehab. So it is a blurry slide, I apologize for that, it's old. So here are the stroke signs: slurred speech, speech that doesn't make any sense, loss of balance, facial droop, and arm weakness. So be faster, get them to the ER fast. Don't even waste any time, just if you see one sign, get them to the ER. So here's the current landscape, and this was what I used to tell patients back in the 80s before we knew a lot more than we did then. Once you have a stroke, there's really nothing you can offer. There's really no improvement over the next few months, and probably over the next year you'll see some, and that's just bogus. It's also a myth that everyone is the same in all rehab facilities. They all get PT, OT, and speech. That's also incorrect, and I'll show you why. And it's also true that there has not been a great deal of research. It's difficult to do research in rehab, and there's lots of reasons for that. So I'll also show you that that's not true. So what causes a stroke? Well, two things: either not enough blood to part of the brain or too much blood. And ischemic stroke is not enough blood. So a little blood clot will trigger off after atrial fibrillation that's formed on the inside of the heart. It'll go up the pipes, and when it gets to a small pipe, it plugs it. So anything downstream from that, all those brain cells are starving for oxygen and nutrients, so they die off. On the other hand, a hemorrhagic stroke usually happens suddenly. It's like an aneurysm that the patient didn't know they had. The aneurysm bursts and you have blood throughout the brain. They immediately complain of terrible headaches, and they need to get to the hospital quickly. Normally though, a hemorrhagic stroke will happen in an older person. They'll have a fall, bump their heads, and they look fine. But over the next several hours, you'll notice they get sleepier and more confused. And you know some of those fragile vessels in their brain have burst, and there's a slow leak. And they need to get to the ER, because that blood may need to be drained off. So those are the two types of stroke, and both need immediate emergent help. A cautionary tale: this is what I see in the ER. I used to see it when I worked the ER a lot. The patient will come in and they'll complain of a tingly arm. And the doc says, well, you know, I think it's probably just a TI. We're going to send you home. We'll give you some aspirin, and I want you to contact your neurologist. If it gets worse, come back. And they go home. Within 24 hours, the whole left side is weak. And that's because the stroke has evolved. They have killed off a few brain cells, and those brain cells begin to kill more. So when these are brain cells, they look exactly like that, all colors. So this is a normal brain cell. You see, they're all happy together. But then one brain cell gets injured. When that brain cell gets injured, its contents leak. And those contents are, I'll talk about it in a minute, free radicals, excitotoxic neurotransmitters, bad things. So when they leak, they touch the membranes of the cell next to them. And that cell goes, wow, I can't take this. And that membrane gets damaged, that leaks. So each time those free radicals touch a next brain cell, that brain cell's membrane gets injured and the contents leak. And that's why that weak arm suddenly turns into an entire left hemiparesis, but it takes maybe a whole day or two for that to evolve. So when you see something like that, maybe you could suggest to the ER doctor, maybe I shouldn't go home, maybe can we watch me in the hospital for a day or so, and implement a full workup. So yeah, you don't want to get to the oh crap stage. So here are the things that happen in your brain. First, that membrane leaks. You have the free radicals, which everybody knows about. If you jog a mile, you get free radicals. You need to take antioxidants. The same thing happens here. Toxins, those are excitatory neurotransmitters that are normal when they're inside the cell, but when they leak out, they kill the cell next to it. And then that cell leaks its free radicals and its neurotoxins, and it just continues to expand like a bomb. And that's why over time you get all of that progressive paralysis. There's also inflammation. As soon as something damages inside the brain mounts this attack. It wants to clean up the damage. So it secretes all these cytokines and antibodies to try to gobble up those things and get rid of them. And that causes more damage, unfortunately. So it's a vicious cycle. It just gets out of hand. So that's why a stroke slowly expands. If you can stop it in that first stage, when that destructive sequence begins, then you can limit the amount of damage. And that's what we want to do. That's what we want to do here, but also especially in the ER. Those free radicals are the first thing that happens. Excitotoxic, the neurotransmitter happens to be glutamate and aspartate, and then the inflammation. If we can suppress that right up front, then we can maybe limit the size of the stroke and the paralysis that follows. That's what we got to do. We got to stop that destructive cascade. Now, that starts as soon as the stroke starts. And after the patient's been in the hospital, over at the other hospital, maybe for a week or two, and everything's stabilized, they send them over to rehab. But in rehab, the stuff is still going on. Those free radicals are still in there. At least we think so. Nobody's really demonstrated the presence of free radicals, but we know they probably didn't just disappear. We know that the excitotoxic neurotransmitters are still there, and we for sure know, and this has been demonstrated, that the brain inflammation is still there. So we still need to stop all of that. So what do we have to do that? Well, we have the supplement that we use in PAM. It's not used anywhere else at this time. It's called Nanex, and it stops this destructive sequence. So even after they come here, we start them on this Nanex. We stop the destructive process. If all of that stuff is still going on, we constrain any more damage that's happening, and then, I'll get to this, we'll rebuild a damaged network, but I'll get to that in a minute. So the things that are in Nanex are these supplements. Pretty benign supplements. We all make them, actually. We've got PQQ, which stops those reactive oxygen species of free radicals, vitamin K2, vitamin D, melatonin. It's not just a sleep hormone. Melatonin scavenges free radicals directly. It also, of course, finds bad cells that are going to try to form a tumor. It does everything in the brain to protect it. So after 40, it goes away. So you want to take some melatonin, even at a tiny dose at night before bed, to protect that brain. It may protect against dementias. You don't see dementia very commonly below 40. You see it after 50. So those are maybe possibilities that melatonin could suppress. Acetylcarnitine and CoQ10. You've heard about CoQ10. It's on the commercial. If you're on a statin drug, you need to take CoQ10. We also want to not only do the free radicals, but we want to suppress those neurotoxins release. So the same things do that. You got the PQQ, you got the vitamin K2, you got vitamin D, melatonin, acetylcarnitine, and CoQ10. All of that's in Nanex. So that will stop those two aspects of the destructive sequence. We're going to use them when they get here. The next thing is suppressing those inflammatories. You've heard about cytokines, you know, the pandemic, everybody had a cytokine storm. If you can stop those cytokines from propagating that inflammation, then you can restrict the damage in the brain. So the same things do that. PQQ, vitamin K2, vitamin D, melatonin, acetylcarnitine, and CoQ10. So that's what you want to start the patient on as soon as they come over to rehab. Because if you can stop that damage from continuing, then the therapist can do the job they need to do. They actually now can start, and on day one, they can start making progress with the therapy. Because as long as that damage is still there and the inflammation is still there, they're going to have trouble. They may have to wait another week before things begin to calm down. But we can stop it when they come in. Now the therapist can work. Now the therapy can work. So now we get to the neuroregeneration process. Between the 70s and the 90s, we didn't think the brain could repair itself. Actually, even longer ago than that, back in 1900, they didn't think it would happen. But in 1991 or 2, there's a New Mexico study that came out that found stem cells in the brain. So we thought, well, man, maybe we can repair the brain because that's what stem cells do. So from that point on, I began to look for what can make those stem cells mature into brain neurons and start synapsing into the adjacent neurons and connecting into the network. So that's what I've been doing for the past 30 years. And there's a thing inside every cell of our bodies called a mitochondria. That mitochondria makes the energy for that cell to function. And it runs off CoQ10, carnitine, and various other things. So if I can save the mitochondria by preserving it with the things that I have in these supplements, then I ought to be able to not only stop the damage, but also start the recovery. And that's what we're trying to do. Start regenerating those stem cells into neurons. And then there's a receptor in those neurons called a sigma-1 receptor in these stem cells. When that gets stimulated and activated, it starts that stem cell to mature. And we used to think that sigma-1 was just a narcotic receptor, and then we found out that it does a whole lot more than that. It works in depression, anxiety, and so much more. But the most important thing to me was the fact that we could make new neurons if we drive it. That's what we're trying to do with this supplement. So we get the patient in the hospital, we stop the destructive sequence, the therapies start cranking up and actually can make progress. And just like that little girl on the piano, the practice over and over, repetitive therapies, just skillfully done by these therapists, can tune these muscles and these synapses to form and start making that connection, just like the little girl doesn't even have to think once she's learned that piece. The patient will learn how to walk, to move their arms, to speak. All of that comes because you've stopped the process and the destructive process, and you've started the regenerative process. That's the exciting part of what we're doing. These mitochondria, these little guys right here, these little sausage guys, they make the energy in the cell, and the sigma-1 lives there. So if you drive the sigma-1 receptor, you overcome that mitochondrial dysfunction, you save the mitochondria, you save the cell, and you start that stem cell regenerating new neurons, which is absolutely phenomenal. So we just drop the destructive cascade with this Nanex supplement, we rebuild the damaged network, and we drive the sigma-1 receptor so the therapy can do what the therapy does best. Only Pam's doing this. Nobody else does this. That's why it's so neat. And we're expanding this into other hospitals around the country, other Pam facilities. And that's what makes it so fun, because you begin to see these programs develop and you know you're affecting lots of lives. So the other thing about sigma-1 that you've got to pay attention to is the fact that it doesn't really get activated unless cholesterol is there. You know, cholesterol is not the bad guy. We need cholesterol. So if we start this statin drug up here, where that X is, everything below that is suppressed. Well, we don't really want that. We may want the cholesterol levels to go down, but look what cholesterol does. It makes cell membranes, It makes the myelin insulation sheath around the neurons. And all of these steroid hormones that we talked about a minute ago that prevent cell death, they go away or they decrease. We want as much as we can. But the more important thing that you can see about limiting that cholesterol is, and blocking that with the X, is our CoQ10 goes away. Well, we talked about CoQ10. We need CoQ10. But even more important than that are these two proteins, these Rho and RAS proteins. Those are proteins that you make from this cascade. And those proteins, Rho and RAS protein, copy the DNA from an existing cell and make a new cell. They make a copy. That's how we regenerate. Not just brain, but everything. So if we're suppressing that, we're defeating the whole purpose of our rehab program. So we've got to eliminate this X if we can. And that's going to take some discussion because it's a hard one to convince people. And I really don't try to convince people. I just talk to them about it. So that's the story about cholesterol. So let me show you a picture. This is a case of a 28-year-old fella. He's walking along the street, minding his own business, going out for a beer with his buddies. And they had a knockout game back in the 80s. And what that was, it was some really twisted individuals would come up behind somebody and hit them right below the skull, and it paralyzes them. Everything goes limp below that. And they would fall and they would hit their head. And there were actually cases of people, elderly people particularly, dying in New York, and they had to really crack down on that. But this happened to this guy at 28. You can see what happened is that he hit the ground with the back of his head here, and he had a skull fracture there and a bleed into the brain. Well, that's a hemorrhagic stroke, right? But then the brain hits the back of the skull, but then it bounces back and hits the front of the skull. So you have a double whammy. You've got a hemorrhage in the front and a brain bleed in the back as well. And so he's a stroke and he's a traumatic brain injury, a skull fracture. So that happened in 2012. He felt like he couldn't really do his job anymore. He was in petroleum industry. He had to quit his job because he didn't feel competent. He was in a room with people and he couldn't really follow the conversation trend, so he just lived in this fog for the next 6 years. So when he finally found me, he came to me, and so we started him on this stuff, and we decided that let's see what happens. Well, I have some friends in University of Colorado in Boulder, and they invented this thing called WAVI EEG. And with WAVI EEG, you can look at something called coherence. Coherence looks like this. This is the WAVI EEG. You have a picture of the brain. Just think about you're looking at the brain from the air, and each one of these little dots is one of the electrodes in the helmet that they're wearing. And what the computer does, it figures out which one is probably connected to the other or talking to the other. So the computers, with its incredible math calculations, it computes, okay, these two frontal lobes are talking to each other. This is the back of the brain, this is the front of the brain, this is the right, and this is the left. So you kind of get oriented on that. So the brain, the coherence draws this map of what's talking to itself. Now there's 4 wavelengths in EEG coherence, but that's not really important for us right now. But you can see that throughout each one of these, the computer is drawing these synapses. So after 30 days on this supplement, each one of these red lines that we've created are new connections. Those are new connections that the brain has developed. That is absolutely unbelievable. Nobody's ever been able to show that. So let's look at it. We've got brain, look, remember where the front of his brain was? He had that fracture or that bleed, and the back of his brain back here. All of those are new synapses repairing the connections that were destroyed in that fall and in that bleed. That is really neat. So we start this on our supplement. We start him in activities, so he's relearning, and he says, I make a full recovery, I'm back to normal after 3 months. 6 years later, Nothing was done for 6 years, and in 3 months, we've got him back to functioning normally. That's really unheard of. That's what we're doing at Pam. That's what we're trying to repair, the stuff that nobody's really been able to do. No other hospital corporation is doing this, and Tony Mizutano is really going all out to try to implement this program throughout his facilities because he sees it working. So what we've learned today, if we've learned anything, we've learned that we do have something to offer, and there'll be more than an improvement in a year, and it's not a lifetime necessarily. We can actually recover a whole lot of function. And everyone doesn't just get PT, OT, speech. We can give a whole lot more here. And it's science, and we know that it can work. And there is research. We're doing that at Clear Lake. I'm working with the guys at University of Colorado in Boulder with the same thing. So all of this is developing just in the Pam facilities. I think it's going to make a huge difference as we expand it into other hospitals. So chemistry plus the therapies, we get recovery of function. That's how it works. That's why that young brain, that little girl playing the piano, she has all this youthful chemistry. We're trying to get that back in our patients. And she practices. That's what therapy is all about. So the neurochemistry is present. You can make brain, but you still got to practice. And that's what we do. Thanks.